Hi all. Now let us see about the comparison of the properties of different dental cements. Okay. So now these cements can be classified into various types, and one such classification is given by Craig, who has classified the cements based on its functions, like for final cementation of the completed prosthesis. We have zinc phosphate, zinc silicophosphate, reinforced zinc oxide eugenol, zinc polycarboxylate, and glass iron cements. And then you have temporary cements like zinc oxide eugenol and non-eugenol. Okay. And then you have high strength bases in the form of zinc phosphate, reinforced zinc oxide eugenol, zinc polycarboxylate, and glass iron. And then you have temporary fillings like zinc oxide eugenol, reinforced zinc oxide eugenol, zinc polycarboxylate. And then you have low strength bases in the form of zinc oxide eugenol and calcium hydroxide. And then you have liners like calcium hydroxide. And then you have varnishes like resins in a solvent. So you can also classify them based on their special application. You have root canal sealers like zinc oxide eugenol and zinc polycarboxylate, and then you have gingival tissue pack, which is a zinc oxide eugenol, and then for surgical dressings, you use zinc oxide eugenol along with zinc oxide preparation, and then you have cementation of orthodontic bands with the help of zinc phosphates and zinc polycarboxylates, and then you have orthodontic bondings done with the help of acrylic resins and composite resins. Again, if we talk about Skinner's classification, he has classified it based on principal uses and secondary uses. Okay. Now, these are the various cements for which the primary use as well as the secondary use is being given. Now, there are basically five categories. So, after seeing all these classifications, the one main conclusion we can come to it is that we have five important cements: zinc phosphate, zinc polycarboxylate, ZIC, zinc oxide eugenol, and resin cements. Okay. So when we talk about zinc phosphate cements, which is otherwise called Western cement, it contains about 81% zinc oxide and nearly about 19% of aluminum silicate. Okay. So the main application of this zinc phosphate cement is in luting and as base and as temporary restoration, orthodontic brackets and brackets luting. The main ADA specification number is 8. Okay, you have type 1 for luting and type 2 for luting as well as filling. Okay, and the setting time is around 5 to 9 minutes. When we talk about the biological properties, the important feature which is associated with this zinc phosphate cement is that the acidity of the cement is significantly higher at the time of insertion. But however, 3 minutes after insertion, 3 minutes after you place the cement, the pH is 3.5, and then it becomes neutral after almost about 2 days. So initially, when you are placing the cement, very important, you have to protect the pulp, especially when it is very closer to the pulp and the dentin thickness is very less. So in such cases, you have to do a liner. And the other important property which is associated with zinc phosphate is that it does not chemically bond to the tooth structure. Next is zinc polycarboxylate. The main significant property of zinc polycarboxylate is that it has a chemical adhesion to tooth structure and is primarily used for cementation of restorations and is also used as a thermal insulating base, mainly for luting as well as base liner, orthodontic, and as root canal fillings. Okay? And because of the high molecular weight and larger size, penetration into the dentinal tubules is very less in case of zinc polycarboxylate cement. And addition, you have a chemical addition to the tooth structure because of the bonding of the carboxyl group with the calcium in the tooth structure. Okay. Next is zinc oxide eugenol cements extensively in dentistry from 1890s. It's been used. These are of low strength, but however, these are least irritating of all the dental cements are known to have an abundant effect on the dentin. Okay, and nowadays we have so many modifications to this zinc oxide eugenol, like we have alumina modified, polymer reinforced zinc oxide eugenol cements. We also have non-eugenol zinc oxide cements which have become available in recent days, especially for those who are very sensitive to eugenol. This thing also you can classify them into four types. You have type 1 for temporary, type 2 for permanent, type 3 for temporary fillings and thermal insulation, and then you have type 4 mainly used as cavity liners. Okay, and again, zinc does not have any chemical addition to tooth structure, and that's why we do not use it for finer cementation. And one of the important characteristics is that it is least irritating of all the cements. Okay, and also, they have a bacteriostatic and obtundant property. And now when we come to the glass ionomer cements, they have chemical addition to tooth structure. Okay, and you can also refer to the glass ionomer cement as polyalkanate cement, GIC, or aluminosilicate polyacrylate. Okay. The main application is in anterior aesthetic restorative material. Then eroded areas you can use as a luting agent, you can use as liners and bases, the core build-up, also as a pit and fissure sealant. Now when you talk about the types, GIC is of 9 types. You can use it for luting, you can use it for restoration, as a liner, base, as a metal modified cement, light cure, pit and fissure, core buildup, orthodontic, and also for atraumatic restorative treatments. Okay, use this GIC. Okay, the setting reaction is that the liquid attacks the surface of the glass particles. Okay, and the calcium, aluminum, sodium, and fluoride ions get leached into the aqueous medium and form complexes. Okay, and the setting time, if you see, it's around 4 to 5 minutes for type 1, and for type 2, it is 7 minutes. Okay, addition, very good chemical addition to enamel as well as dentin because of the reaction between the carboxyl group and the calcium in the appetite of the natural. Okay. Also, the bonding of enamel is higher in compared to that of dentin because of the greater amount of inorganic content present in the enamel. Okay. The biocompatibility is very good for GAC. Also, it has anti-carcinogenic effect. Okay. Because of the release of fluorides. Now, to reduce the incidence of sensitivity with glass ionomer what you can do is sometimes when you have sensitivity with glass ionomer to avoid that, you can do rapid incorporation of powder and liquid on the pad. Okay, and some slight hydration of the tooth can be done before you apply the cement to the tooth and blot it out with cotton just before placing the cement. Okay, and you can also place varnish on the surface of the cement. Okay, and the glass enamel cement is one of the cements which is getting improved every now and then. Okay, with incorporation of newer materials into GIC to improve its properties. Okay, you have metal modified GICs, you have like you have silver alloy admix and summit. Okay, and then you have resin based cements which are now available. Okay, these are the various cements. In this resin-based cements, you can see that organophosphates, hydroxyethyl methacrylate, and 4-metacrylo ethyl tri methyl anhydride. Okay, all these have been added. Okay, so why we are adding this is to bond to dentin. Okay, the biological property is that pulp protection is very good because of the calcium hydroxide or GIC liner, which has to be applied beneath this resin-based cement. Okay, so resin-based cement as such has a very high irritating effect to the pulp, and because to avoid this irritation to the pulp, we have to have a calcium hydroxide or a glass ionomer liner. So this is a comparative chart which is going to compare the properties of various cements. So you can see here you have film thickness, solubility, setting time, working time, strength in terms of compressive strength and tensile strength, then elastic modulus and pH immediately after placement and 24 hours after placement being discussed for various cements. So if you take zinc phosphate, The film thickness is around 25 microns. Okay. Solubility is 0.2% max and not more than that. Setting time is around 5 to 14 minutes. The working time is 3 to 6 minutes. Strength is significantly good. So when you take in terms of film thickness is almost good for almost all cements except for silicophosphate where it is too thick, and then for all others it's almost okay. Alumina reinforced, epoxide using all. Only these are the few cements for whom the film thickness is too much, but otherwise film thickness is 25 or less than 25, which is tolerable. And then when you take about solubility, you don't want it to be soluble in the oral cavity. So if you see here, solubility is very less except for zinc oxide eugenol, perhaps the solubility is high, but the value is not here. But the most soluble would be perhaps zinc oxide eugenol. Okay, and then if you take about the setting time almost comes around 5 minutes, okay, except for polymer reinforced and alumina reinforced, for which it is coming from 7 to 9 minutes. The working time, however, is around 3 minutes max. Okay, and strength, if you see, the strength is highest glass ionomer cements, you can see it's around 226. Okay. The strength is very good for glass ionomer cement, and tensile strength again is high for resin modified GIC and composite resins. It's also good for zinc polycarboxylate cements. Okay, and then elastic modulus. Elastic modulus, if you see, for zinc phosphate, the elastic modulus is 13, which is almost nearer to that of the enamel and dentin. Okay, so elastic modulus for the zinc phosphate is very significant here. Okay. Next to zinc phosphate comes GIC, okay. And copper phosphate is highly acidic, but however all others they are not that acidic. Okay, and mhm. So when you come to the next comparison table, here you can see that film thickness ideally has to be low, which is around less than 25. So it's almost less than 25 for everything except for resin cement, which is little higher than 25. Okay, and working time, if you see, setting time. Okay, so all these are the various comparisons which we have given. But however, in the MCQs, this is not how they ask. They don't exactly ask you the values, but it's a comparison they ask. So now we'll just discuss about a few comparison properties of the materials which has been asked in the previous years. Okay. So, okay. So the first question is, which of the following cements is most irritant to the pulpy tissue? Okay. So it's always silicates. So whenever an option of silicate is given, you can blindly tell that it is silicates which are most irritant to the pulp. Okay. So which of the following do polycarboxylates and GICs have in common? The answer is polyacrylic acid. Okay. Next question is, the setting time of zinc phosphate is retarded by. So how do you retard the setting time? By adding, by decreasing the addition of powder to the liquid. So the ratio by which you are going to add powder to the liquid, if you are going to decrease, then again the setting time will be retarded. Okay. Next question is, which of the following cements is most kind to the pulp? Okay. The most kind to the pulp would be polycarboxylate. Definitely not silicates and resin cements because they're most irritant to the pulp. Silicates and resin cements. So very kind to the pulp means it is polycarboxylates. Okay. And then the cement which is least soluble in the oral cavity. Okay. The answer is resin cement. Okay. So resin cement does not get soluble in the oral cavity. So the answer for the fifth question is resin cement. Whereas polycarboxylate cement is the most soluble resin cement. So when the question is most soluble, your answer would be polycarboxylate. But whereas when the question is least soluble, the answer is glass ionomer cement. So the next question is, which cement is irritating to the pulp? I told you the one which is irritating to the pulp would be zinc phosphate. because initially at the time of insertion its pH is, it's too acidic, and that is why zinc phosphate is the most irritating to the pulp. In case if silicate cements were given, okay, if silicate cement was given, then maybe silicate should have been an answer, but otherwise here the answer, the most apt answer would be zinc phosphate. Okay. So, which of the following cement is most biocompatible with pulp? Okay, GAC, copper cement, zinc phosphate, and zinc oxide eugenol. Definitely not zinc phosphate, definitely not copper. Now, when you compare GAC with zinc oxide eugenol, it is zinc oxide eugenol. Okay, that is more compatible, biocompatible with the pulp. So, the most biocompatible cements to the pulp would be zinc oxide eugenol, followed by polycarboxylate, GAC, and then last would come your zinc phosphate. Okay, but whereas the most irritating effect on the pulp is due to the resin cements and silicate cements. So one thing is the resin cements is that, or the silicate cements is that the most irritating to the pulp. But however, least soluble, okay, least soluble would be resin cements, but most irritating to the pulp would also be resin cements. Okay. The next question is most soluble cement. Okay, so the most soluble cement according to the clinical studies, okay, this is how the answer is. You have DIC, which is the least soluble, okay, and then you have zinc phosphate, then you have zinc oxygenol, then you have polycarboxylate. So various studies have shown that polycarboxylate has a very high solubility inside the oral cavity. So answer would be polycarboxylate. Next to polycarboxylate would fall zinc oxygenol, then comes your zinc phosphate, and then your GIC. Next, secondary caries. Secondary caries is least likely seen with silicate cements. Okay. And which of the following cements bonds to tube structure, has an anti-carriaging property, has a degree of translucency, and does not irritate the pulp? So definitely the answer would be glass ionomer cement, because that is what is bonding chemically to tube structure. Okay. Carriagenic effect because of the release of fluorides. Also, it is not irritating to the pulp. The next question is, which cement base has the highest modulus of elasticity? I told you it is zinc phosphate, which has around 13 elastic modulus. So that has the highest modulus of elasticity. Next, which of the following restorative materials is having coefficient of thermal expansion closer to that of tooth enamel and dentin? Okay, the answer is type 2 glass ionomer cement. Glass to ionomer cement has a coefficient of thermal expansion which is very close to that of enamel and dentin. Next, which of the following dental cements does not contain water as part of the composition of liquid component? Okay, the answer is zinc oxide eugenol. Whereas zinc phosphate, zinc polycarboxylate, and zinc silicate phosphate will have water, whereas zinc oxide eugenol does not have water. The main advantage of zinc phosphate over GAC is its elastic modulus, which is 13. Okay. So high modulus of elasticity is the characteristic feature of zinc phosphate when compared to that of GAC. So these are the few questions which have been asked in relation to the comparison of dental cements. Thank you.